I am Adam Wright from Vanderbilt University and the Vanderbilt Clinical Informatics Center, and I'm going to talk to you guys about a program that we did called Clickbusters. And it's kind of an interesting program to be presenting right now because, at least in its first incarnation, it had as much to do with alerts as it did with documentation. But it was an initiative we put together that was really focused on making Epic work better at Vanderbilt. We buy Epic from Epic, but we configure it ourselves. And so there's a lot of control we have over the user's experience. And so we wanted to make sure that we were doing things as efficiently as possible. And so we brought people from across our organizations, from our Department of Biomedical Informatics, physicians who were Epic physician builders, nurses who were trained as nurse builders, pharmacists, and others, and sort of gave them an opportunity to, in the spirit of kind of the adopt a highway program, right? You adopt a stretch of road to keep clean. You could sort of adopt a little chunk of the EHR to sort of improve yourself with the goal of making it more useful for our end users. And so these are a couple alerts. The reason I think this is relevant even in the context of 25 by 5 in this documentation thing is a lot of our alerts have to do with documentation. These are a couple of alerts in our EHR that encourage you to document things. They may even let you document things right there. But we've also now started looking at ways that we can expand this program from reducing clicks on alerts to reducing clicks in documentation, kind of like we saw with Project Joy and other contexts. And so we started this process by recruiting people. You'll see we had about 30 people who so far have participated in the program. People pick what they want to adopt. We have a kind of structured process that they go through to learn more about the alert that they've adopted to sort of improve. And we try to give them support throughout the process. And what that looks like is, a group of us led by myself and Allison McCoy, another faculty member at Vanderbilt, created a series of videos that teach people sort of how to analyze aspects of the EHR, to look at data from the data warehouse, to kind of participate as full-scale builders, even if their main job is something besides being a builder. We checked in with them regularly, in some cases virtually, as a lot of this work was done during COVID, just to kind of help them stay on track and stay motivated and give them some encouragement. I don't have time to go through the entire 10-step click-busting process, but I wanted to highlight a few things that I think are especially relevant in this documentation context. So I'm going to jump, right to the sort of metrics. So we sort of rank ordered the alerts that we had at Vanderbilt by things like how often they fired, how often they were accepted, what parts of the hospital they targeted. This is all available from our data warehouse. And we've done similar things like with Project Joy. We looked at, flow sheet rows, where are those being used, documentation templates, who's using which templates, order sets. And so you really can kind of prioritize improvements in your system using data. And I think that's really important because there's sort of this 80-20 rule, right? A small number of heavy hitters can be really annoying. And if we can improve those, we can get a lot of clicks out of the system and reduce a lot of time dealing with alerts, times dealing with documentation. So the first thing that we did was we tried to build some tools. This is a visualization tool that allows users to explore, how often alerts are, a given alert is firing. This is our flu shot alert, who's getting it, where they're getting it, what action they're taking when they get it. And so this data came out of our Epic data warehouse, and Epic has some tools for visualizing it. We made this tool that we thought was a little bit more user-friendly. But I think the point is this would apply just as well to documentation, right? Could we see what flow sheet rows are being used, what required or non-required fields are being filled out, where are they being filled out, where are they being ignored? So kind of bringing data to the problem, I think, becomes super important. I think all of us are probably sitting on more log data and more data that informs these things than we know we are, or that we're probably taking advantage of. So we're always trying to improve that. So that's the second step of our 10-step process. We also have a lot of focus in our clickbusting education about sort of empathy for the end user, right? Like I think a lot of us spend all of our time doing informatics, or the majority of our time doing informatics, and forget that, most of our users are, nursing every day, all day, doctoring every day, all day, pharmacisting all day, every day. And so kind of appreciating their experience, the demands on their time, I think becomes really, really important. So one way that we encourage people to do that is by looking at feedback from users. So we went through all of our alerts and we added these little smiley faces where users can kind of upvote or downvote an alert. If they click one of the smiley faces, they can leave a comment about what worked well for them or what didn't work well. We've now migrated this to our chart review activity, some of our kind of data presentation tools, order sets. What's been amazing interesting is that users are really willing to invest actually quite a bit of time giving us feedback, I think in hopes that we'll do something. And they're often sort of amazed that we're listening to them, right? So a user clicks a frowny face and they say, this didn't make sense for my patient, and they tell me why. And I write back, a couple hours later and I say, wow, you were right. That didn't make sense, while your patient was in the operating room. How are you going to ask them if they're smoking? And so we adjusted the firing for that alert, and, thank you. And people are amazed that, a real human sits on the other side of this email. At the beginning, some of them would sort of write like, grumpy things like, you idiots, what are you doing? But once they realized the person was reading them, they were a lot nicer. And even when we can't fix things, or we have to tell people something is there for a regulatory requirement or something like that, people are so appreciative just to hear back. So that's, I think, my first suggestion here is gather feedback from your users, communicate with your users, and have empathy for your users. You can also be a little more proactive with them. This is reactive, right? We wait for the user to tell us something. We also realized that we could figure out who were the top 10 people that got each alert. And so we sent them emails and said, hey, you get this alert a lot. It's probably not you, it's probably us. Tell us if this alert is useful and how often, how you think it could be improved. Amazingly, a lot of people wrote back and said, I don't remember getting this alert, even though they have gotten it dozens or hundreds of times in the last week and they've acted on it. So that kind of is a wake-up call. And I think you might see some similar things like, how useful was this documentation feature? Like, was it important for you to document this? People may say, I don't even remember documenting that. Or they may say, here's a better default. Or they may say, here's another way you could do that. So I really think that proactively reaching out to users turns out to be super, super beneficial. I'm skipping the whole rest of the process because it's a little bit maybe more alert specific. But one of the things we've also been trying to do as part of Clickbusters is encourage our users to sort of evaluate the work that they did and then share the results beyond the walls of our organization, right? So when we found ways to improve our smoking documentation alerts or our opioid, prescribing alerts, we encourage people to come to FAMIA. FAMIA is a great venue. This is a great venue to present your research, HIMSS, our journals, and then, we use Epic. So we've been taking advantage of meetings like UGM or XGM to share some of these stories. But I really think as I just sort of sit here on this panel listening to my panelists, I'm so inspired by things I'm hearing from UCSF and from the Hong Kong Hospital Authority. And so I really think just the power of something like FAMIA to convene us to share our lessons is really, really important. So let me tell you what happened. First off, I should have said this earlier, but we gave fabulous prizes. So you could win a Clickbusters ribbon or this kind of coveted golden mouse computer trophy that you can see off to the side there, which we found on the internet. And so everybody got a certificate. Some people actually were interested in academic credit for this. So we wrote letters to their department chair telling them what a great job their staff member did. And we featured our winners in the monthly newsletter. But in the first round, we had 9 participants. That was our smaller round. But we managed, just with 9 people in a few weeks, to reduce our alert firing at Vanderbilt by about 10%. So that's 49,000 clicks every week that are now out of the system. These were, in many cases, sort of junky clicks. They were old alerts that didn't make sense anymore. The evidence had changed. Our practice had changed. We had other ways of getting that information. And so we were really excited to be able to sort of get rid of that many clicks. And we started a second round. We had more participants in the second round, 20 participants. You can see our 3 winners over there. We had this time about a further 5% reduction. I think we got rid of some of the easiest things in the first round. So these were harder won, but I still think there's a lot more victories that we can achieve. And one of the sort of things that I didn't really anticipate that we did was we started to create this community of people. This is, not even all of the 20 some odd people that participated in the program who, their full-time job is being a nurse, being a NICU doctor, being a pharmacist, but they devoted some of their time. They started to realize that they had a say, that they could help influence the system. They gave us their expertise. They gave freely of their time, except for these trophies that we mailed to their houses. And it was amazing to have this community of people. I now have people I can call on when I have questions about alerts or documentation tools that we're creating. And so I was really proud to sort of help participate in this initiative. And I was trying to think, what does this mean for the 25 by 20, 25 by 5, not 25 program? I think the first one is engage your users, especially kind of the super users or builders that want to get involved in improving your system. They'll be really excited to be invited and to be asked. They'll do great work for you. They're a way to kind of extend your army of informaticians beyond the kind of few of us that sit in the informatics layer to the entire organization.
1 minute.
What's that?
1 minute.
All right, I'll be done. You got it. Thanks, Kenner. Listen to their feedback. So create tools like those smiley faces to get feedback on every data collection opportunity, every documentation tool. Learn from users what they're worried about, what's working well for them, and what's not working for them. They know more than anybody, more than you do, about what's working. Also, use your data, right? I mean, we have committees that discuss things. Sometimes things have a right or wrong evidence-based answer, but sometimes things are kind of on the border. Should there be a default? What should the default be? Should this be a required field? Look at the data. If you make it a required field and people are putting like just a period or a blank space in it 90% of the time, maybe it shouldn't be a required field anymore. You're not really getting any real data out of it. And then the last thing is I think has come up a few times is I think Epic's been a great partner as we did this. They've helped us disseminate this to other users. They gave us feedback on the program. They've helped us. They've improved some of their tools based on our feedback. They told us how we could improve their tools. This really has to be a partnership between healthcare provider organizations and EHR vendors and also clinical content providers. So it's really gratifying to see the diversity of people who are on the phone today or in this group. So that's all for today. Just want to say thanks for the opportunity to chat with you guys. Really appreciate it.